Have you ever wondered what your body is quietly trying to tell you as you age? As a doctor with over 20 years helping seniors thrive, I'm here to share a truth: your health, especially your prostate health, is in your hands. Today, we're diving into a topic that's vital for every man over 50 in Canada, and those younger who want to stay ahead. We're talking about your prostate, that small but mighty gland that impacts your energy, confidence, and joy. Stick with me, because I'm sharing science-backed insights, practical tips, and a powerful call to take charge of your vitality. Ready to feel proud of your body again? Let's get started. As a Canadian doctor, I've seen how our harsh winters, busy lives, and even cultural hesitations about discussing men's health can make it easy to ignore the prostate. But here's the reality: prostate issues affect 1 in 8 Canadian men, and by age 60, over 50% will face some form of prostate enlargement, known as benign prostatic hyperplasia, BPH. These aren't just numbers, they're stories of men who deserve to live with strength and dignity. Your prostate isn't just about biology, it's about your ability to enjoy life, from skating with your grandkids on a frozen rink to savoring a warm Tim Hortons coffee without worrying about discomfort. Today, I'm here as your guide, like a friend who's walked this path with thousands of patients. We'll uncover how small habits, like diet, exercise, and even regular ejaculation, can transform your prostate health and empower you to age with pride. So, grab a notebook, and let's dive in. What's one thing you've heard about prostate health that's made you curious? Drop it in the comments below, I'm reading every one. Let's start with the basics. The prostate is a walnut-sized gland below your bladder, surrounding the urethra. It produces fluid that nourishes sperm, playing a starring role in reproduction. But its impact goes beyond that, it's a gatekeeper of your vitality. A healthy prostate supports urinary function, sexual health, and even your emotional well-being. As we age, the prostate can change. Hormones like testosterone and its derivative, dihydrotestosterone, DHT, naturally shift, sometimes causing the prostate to grow. This is where BPH comes in, leading to symptoms like frequent urination, weak streams, or that frustrating feeling of not fully emptying your bladder. In Canada, where long waits for specialists can be a reality, prevention is your best ally. But here's the exciting part: you have the power to influence these changes. Research shows that lifestyle choices, from what you eat to how active you are, can reduce your risk of prostate issues by up to 30%. That's not just science, it's hope. So, what's one habit you're already doing to support your health? Share it in the comments, let's inspire each other. Now, let's talk about something that might raise eyebrows but is grounded in science: ejaculation. Yes, I said it. As a doctor, I'm here to break taboos and share facts. Studies, like one from Harvard in 2016, found that men who ejaculate frequently, about 21 times a month, have a 20% lower risk of prostate cancer. Why? Ejaculation acts like a natural cleanse, flushing out potential carcinogens and reducing congestion in the prostate. Here's how it works: when you ejaculate, your pelvic muscles contract, clearing prostatic fluid and keeping the gland active. Without this, congestion can lead to discomfort, a condition called congestive prostatitis, which affects 10 to 15% of men over 50. Symptoms include pelvic pain, pressure, or trouble urinating, things no one wants to deal with during a Canadian winter. But ejaculation isn't a magic bullet. It's part of a bigger picture. Chronic inflammation, often caused by oxidative stress or poor diet, is another silent threat. In Canada, where processed foods are common, this is a real concern. The good news? You can fight back with foods rich in antioxidants. Think juicy tomatoes, wild blueberries from Nova Scotia, or a steaming cup of green tea. These aren't just tasty, they're your prostate's best friends. Have you tried adding antioxidant-rich foods to your diet? What's your favorite? Let me know in the comments. Let's dive deeper into hormones, because they're the conductors of your body's orchestra. As men age, testosterone and DHT levels naturally shift, sometimes overstimulating the prostate. This can lead to BPH or, in rare cases, more serious issues. But here's where ejaculation shines again. It temporarily lowers DHT levels, giving your prostate a breather. This isn't about doing it daily, moderation is key. The goal is balance, not excess. Combine this with habits like regular exercise. A brisk walk through Stanley Park or a skate on the Rideau Canal boosts circulation, reduces inflammation, and supports hormonal health. In fact, a 2020 Canadian study found that men who exercise 150 minutes a week have a 25% lower risk of BPH. That's the power of movement. What's your favorite way to stay active, especially in Canada's chilly winters? Share your tips below. Prostate cancer is a heavy topic, but we're facing it head-on. In Canada, it's the most common cancer in men, with 23,300 new cases in 2024 alone, according to the Canadian Cancer Society. But here's the hope: early detection and proactive habits can change the game. Regular ejaculation may reduce your risk, but screening is non-negotiable. The prostate-specific antigen (PSA) test, available through your family doctor, is a simple blood test that can catch issues early. If you have a family history or symptoms like blood in your urine, don't wait. In Canada, where healthcare access can vary, advocating for yourself is crucial. Book that appointment, it's an act of courage. Have you or a loved one had a PSA test? What was your experience? Let's start a conversation in the comments. Prostate health isn't just physical, it's deeply personal. Masturbation, when done mindfully, can be a tool for self-awareness. Notice changes in sensation, semen quality, or comfort. These are your body's signals, like a check engine light. Acting on them, by seeing a doctor, is an act of self-respect. Let's talk about how to make this practice meaningful. Set aside time, free from distractions. Maybe it's after a warm bath or a quiet evening in your cozy Canadian home. Use water-based lubricants for comfort, and always prioritize hygiene to avoid infections. This isn't just about pleasure, it's about honoring your body. And don't forget Kegel exercises. These strengthen your pelvic floor, supporting your prostate and enhancing sexual health. Try contracting your pelvic muscles for 5 seconds, then relax. Do 10 reps, 3 times a day. It's discreet, you can do it while waiting for your poutine order. Have you tried Kegels or mindful self-care? What's one new habit you're excited to try? Share below. Your diet is your foundation. In Canada, we're lucky to have access to incredible foods. Tomatoes, rich in lycopene, reduce prostate inflammation. Wild salmon, packed with omega-3s, supports hormonal balance. And don't skip those leafy greens, they're like a love letter to your cells. Cut back on processed foods, like sugary Timbits or fast food burgers. A 2023 study from the University of Toronto linked high processed food intake to a 15% higher risk of prostate issues. Instead, try a hearty lentil soup or a berry smoothie. Your prostate, and your taste buds, will thank you. What's a healthy Canadian dish you love? Drop your recipe in the comments. Caring for your prostate isn't just about your body, it's about your spirit. When you prioritize your health, you're boosting your confidence and self-worth. This ripples into your relationships, whether it's dancing with your partner at a ceilidh or cheering at a Leafs game with friends. If guilt or shame about masturbation lingers, reflect on why. These feelings often come from outdated norms, not truth. You're not alone, many Canadian men feel this way. Talking to a trusted friend, partner, or therapist can be freeing. Your health is your legacy, embrace it with pride. How do you boost your emotional well-being? Share your story below, let's uplift each other. Let's wrap up with actionable steps to take control of your prostate health. 1. Stay active, aim for 150 minutes of exercise weekly, think hockey, snowshoeing, or a walk in Banff. 2. Eat smart, load up on tomatoes, berries, salmon, and greens. Limit processed foods. 3. Practice Kegels, strengthen your pelvic floor for better prostate and sexual health. 4. Ejaculate regularly, aim for moderation, it's a natural cleanse for your prostate. 5. Get screened, talk to your doctor about PSA tests, especially if you're over 50 or have a family history. 6. Be mindful, use masturbation as a tool to listen to your body and stay connected. These aren't just tips, they're a roadmap to a vibrant life. You're not just aging, you're thriving. My friends, your prostate health is your power, your foundation, your legacy. As a Canadian, you've faced blizzards, long winters, and maybe even a losing hockey season, but you've never backed down. Don't back down from your health. Start today with one small step, maybe it's booking a doctor's appointment, trying a new recipe, or simply taking a moment to breathe and connect with yourself. I'm Dr. Anna Schneider, and I'm so proud to walk this journey with you. If this video inspired you, give it a thumbs up and share it with a friend who needs to hear this. Subscribe and hit the bell so we can keep exploring health together. And here's my challenge. In the comments, tell me one thing you're doing to take charge of your health and where you're watching from. Are you in Vancouver, Toronto, or maybe a small town in Alberta? I can't wait to hear from you.